Hi, everybody. Welcome to the community update. My name is Angela Cimental. I am the Communications and Marketing Manager for Boulder County Public Health. We're glad you're here today, and we hope that this regular COVID-19 updates will give you an opportunity to hear more about the COVID-19 response here in Boulder County. We hope to answer any questions you may have. Again, just a little reminder that if you won't be asking any questions, you can also watch live this community update on the Public Health YouTube page at bogo.org/PH YouTube. I want to go into some housekeeping items, and before we get started, you will hear today from Lexi Nolan, our Interim Executive Director for Boulder County Public Health, Trina Rowland, Boulder County Attorney, and Lisbeth Mendoza, Equity Community Coordinator. So here are some housekeeping rules. We will be taking questions at the end of the update using the Q&A feature at the bottom of your Zoom screen. So please type your question during the Q&A section. For those on the phone, you can dial *9 to raise your hand, and we will call on you to ask your question. To unmute, you can use *6. Please keep your questions short, and we'll get to many as we can as possible. And now I'm going to turn it over to Lexi, Executive Director of Boulder County Public Health.
Thank you, Angela. So can you see my screen now? Great. Good afternoon and welcome. Thank you all for joining us today. I am going to talk a little bit about, we're going to talk a little bit about our current public health orders. We're also going to talk a little bit about data and some of the trends that we're watching carefully. And we really hope to engage your support as our community members, our business leaders, and our local parents so that we can open more in May and have a great summer together. So to get us started, to talk about the new Dial Public Health Order and the continued masking order is Trina Rowland from the County Attorney's Office.
Thanks, Lexi. So folks may have heard that on April 15th, the state devolved its dial order. That's the system that we've been working on under since about June of last year. Because of that, Boulder County Public Health partnered with our metro region and some other counties around the state, looked at our numbers and assessed that it wouldn't be appropriate for our jurisdictions to move into basically no restrictions right now. So we adopted, as the state suggested, the dial framework at a local level. And this has been adopted metro-wide and now covers much of the population of Colorado. From April 16th to May 16th, we are in level blue. And what that means is that a lot of our things that we are used to, the 6 feet of distancing and the masks, are still in place. But we do have some slightly expanded capacities for some of our businesses. Indoor public spaces, your restaurants, your offices, your gyms, the requirement is that there be 6 feet of distancing between people. And in many businesses, you can go up to 100% capacity, such as restaurants, as long as you can maintain that 6 feet of distancing. Last call has been moved to 2 a.m., which is actually the pre-pandemic last call time. Offices are increased to 75%. There is still a limit on indoor personal social gatherings. We ask that folks follow CDC guidance, which allows for small gatherings indoors as long as folks are masked, but there are some provisions if you're vaccinated. And presumptively, a personal social gathering is about 10 people. There is no limit, but we ask that you be intelligent about this, to outdoor gatherings. Any business or organization that wants to have an outdoor gathering greater than 500 must submit their plan to Boulder County Public Health. One of the overarching goals of this order is to encourage folks, if they do want to gather outside, where while the risk of transmission is not zero, it is significantly less than the risk of transmission indoors. Indoor events are capped at 175 people unless you are fully seated, in which case you can go up to 500 people if you are fully seated indoors with those 6 feet of distancing. And if you want to go over that, you must get Boulder County Public Health approval. Next slide, please. While we're in level blue from this April 15th to May 16th, 5-star is still in operation. We have about 60 businesses in Boulder County who are operating under the 5-star program. Recall that this is businesses that go above and beyond the COVID requirements, the COVID risk mitigation requirements in the public health order, and implement additional requirements. And in exchange for that, they get to operate with increased capacities. So while we're in this level blue, our 5-star businesses are actually allowed to operate in level clear. They must still have masks while they're in their indoor spaces, and restaurants are limited to 3 feet between households instead of the 6. This last bullet point that certain businesses must have 6 feet of distancing if there's 100 plus people, that is because of the state order. That's not a requirement that Boulder County Public Health can waive. Next slide, please. Once we hit May 16th, our local public health order will move us into what is called level clear. This level clear is a monitoring period that will be in effect over the summer from May 16th to August 16th. Boulder County Public Health and our neighboring jurisdictions will all continue to track cases, investigate outbreaks, encourage testing, and hopefully get through the remainder of vaccinations. The goal of this level clear is to lift restrictions while keeping what we call a snapback provision in place, so that if we see an uptick in hospital admissions of county residents due to COVID-19, we will move back into a more protective level, the blue, the yellow, the orange, if need be. I want to talk briefly about the indoor mask order. On April 6th, Boulder County Public Health amended its mask order in reflection of the increased vaccination rates to no longer require masks in outdoor settings. However, masks are still recommended in outdoor settings if you cannot maintain 6 feet of distancing. Masks are still required in all indoor public places, regardless of group size or vaccination status, until May 6th. The state also has a mask order in place, but Boulder County Public Health's order is more protective, and that is the one you should follow if you are confused. Boulder County Public Health will be reassessing our mask order on a little bit before May 6th to determine whether it should be extended, amended, or modified. Next slide, please.
That's it.
Thank you.
Thank you very much, Trina. So we wanted to start with the public health orders so that everyone has a context of what we're doing to try to get back to normal. But we also have some work to do between now and May 16th to be able to move into that clear level with confidence. So we've moved into level blue, but we aren't really out of the woods yet. We've still got cases, we still have transmission, and we want to talk a little bit about that. And our ability to move to clear in May will really depend on what happens next and how the community recognizes their need to step in and take responsibility for some of these really important actions that are coming. So what do we need to do? This is what we're seeing from the data, and I'll go into a little more detail in a minute, but the long and the short of it is we need to keep our pace of vaccinations. We're starting to see some drop off in the pace of people getting vaccinated, and we really need that pace to continue to be able to get to where we need to get by mid-May. We do have lots of help available for people to get signed up to for registration or to get transportation support, and to make sure that they are going to a clinic that feels like a safe space for them. Number two, we need to keep testing. We really need everyone to maintain high levels of testing so that we are confident that we are catching the cases that are being transmitted in our community, and that we can mitigate those and contain them effectively so that we can really get a handle on this virus. And it's getting a little more complicated with the variants, and we're seeing some different patterns of case spread that we'll talk about. We do still have free testing at the fairgrounds in Stasios, and that will continue until the end of June. Number three, we really have to keep transmission control in place. That means keep masking, especially if you're indoors or if you're not vaccinated. It also includes social distancing whenever possible, washing hands. And number four, and this is part of what we're seeing that's emerging, is we really need to be very conscientious about protecting children and youth. And that means protecting them during out of school activities, whether it's a sleepover or after school sports or extracurriculars or just getting together with friends. And we also need to be sure that we're following the guidelines and that we're cooperating with public health officials who are working really hard to keep everybody safe. So let's dig a little bit deeper into why these four things are really critical. So keeping pace of vaccination. So we're really doing great in a lot of ways. We now have 60%, 61% almost of the Boulder adult population that's received at least one dose of the COVID vaccine. And that's terrific. And we are administering about 3,850 doses a day. So our ability, our infrastructure is very strong to be able to deliver a lot of vaccinations. And we are getting an increased supply from what we saw a month ago, say. And that's terrific. But here's the caveat. What we're starting to see is that the pace of vaccinations, including across metro counties, including Boulder County, is beginning to level off a little bit. So we don't have that continued steep angle that we were seeing a few weeks ago. You may have noticed it's easier to get a vaccination appointment now. That's because we've gotten a lot of folks vaccinated. We still have a robust infrastructure and a plentiful supply of vaccine. Now's the time to jump in and get your vaccination done. The problem with this leveling off is that we haven't gotten enough people vaccinated yet for us to want to see that leveling off. We still need to see that pace continuing, similar to what we were seeing in the previous weeks. And this is why. We're trying to reach a goal of 80% by May 15th that would give us a lot more confidence about going into level clear. And May 15th is the date that that would happen. But if you look here, what you see is that this trajectory, the projection is a straight line, but we know that once we start leveling off here, that projection may actually look quite a bit lower, in which case we may not achieve our objective unless people are really staying focused on getting into those vaccine appointments. So who are we focused on? Well, we're doing great, especially with folks that are over 60. We have 80% of our 60 to 69 population and 92% of our 70 plus population. So that's wonderful. But we really need to go ahead and keep working on our under 60 population, and in particular, our ages 16 to 30, who are all already eligible for vaccinations, and get some of those numbers up. Our 10 to 19, which, I mean, we use these age breakouts because this is what we have data for. Obviously, some of these kids aren't eligible to get vaccinated yet, but we see in that space 15%. And our 20 to 29-year-olds are at 40%. So if we can get those numbers up between 16 and 30, that would be really helpful. We also have a focus on the BIPOC population. And one thing I want to be real clear about with this chart is that these numbers here is a breakout of this number of the complete BIPOC population down here. So what we're really looking at is these two populations, and we've got about 60% of the white non-Hispanic population vaccinated. We have about 35% of the BIPOC population vaccinated, which is a population that tends to experience a lot more barriers to being able to get vaccines. And so we're doing a lot of work to support folks, particularly BIPOC folks, to be able to get to vaccination clinics and get registered. This is a map that shows where vaccination uptake is strongest and weaker. And we have really positioned a lot of our clinics, a lot of our equity-focused clinics, in places where the vaccine uptake could be stronger. Of course, in addition to all of the equity clinics that I'll tell you a little bit more about in a minute, we also have a wide range of providers, from our pharmacies to our hospital systems and healthcare systems, who are also providing vaccines. So as mentioned, we have these traditional and equity clinics. And I just want to talk to you a little bit more about the equity clinics, because we've been really able to scale these up quite a bit lately. And we have at least 6 clinics that are now running weekly at Longmont, in Lafayette, and at the fairgrounds. And what we're really hoping and working hard to do with these clinics is to create safe spaces for people to come, regardless of who they are, what their background is, what language they speak, how they present, whatever diversity they have, to really feel welcome, and to feel like there are people there at the clinic that they recognize, that they feel comfortable with, and really just creating an inviting space for them. So we really encourage folks, if you're not comfortable with going to a traditional provider, to get in touch with the Boulder County call center to get help to register for one of these clinics. And that information is here. There is some additional information that you can go back and look at the recording to capture about where you can find other kinds of information that might be helpful for you. Okay, so the second issue on the list was increased transmission control. And what we're seeing statewide is that transmission control, and when we say transmission control, what we're talking about is a combination of things like masking, social distancing, washing hands. It's a combination of efforts. But what we're seeing is that they are in control of individual people, right? And what we're seeing is that transmission control is decreasing, and it's kind of at its lowest level it's been since the start of the pandemic and the emphasis on transmission control. So we're at these all-time lows, and we need to keep transmission control up for a few more weeks so that we can get vaccinated and be safe. And so what we have to do is keep masked, keep socially distanced whenever you can, get tested, and follow quarantine guidelines so that you're not spreading disease. And we've had some very tragic cases lately where there have been really serious impacts on families because they weren't getting tested, they weren't following quarantine guidelines, they weren't necessarily doing the things to really make sure that their families and their friends were being protected when they needed to be. So third, reducing transmission, especially among our youth. So this is the population where we're seeing increased numbers. Now, in general, we're seeing pretty variable levels of cases per day. It's ranged anywhere in the last week between 28 cases and over 100 cases in a day. So it's kind of unpredictable right now. And what we really want is we want those numbers to come down and be a little bit more predictable. And if we take a breakout of the age groups, what we're seeing is that the rates are highest among our young folks. And it's a combination of not being vaccinated, but also of not taking enough precautions while they're unvaccinated. And in the 18 to 22 population, it's very erratic, the rates are. And in the 20 to 34 population, we still have some concerns. You'll remember those are populations that are eligible to be vaccinated, but haven't gotten as deep into the vaccination numbers as we would like. So that's why we're focusing on those populations to really go ahead and get vaccinated. Then we have some younger populations like 0 to 9 and particularly 10 to 17, this orange line right here, where we've seen a big spike over the last few weeks. It seems to be going down now. We hope it continues to fall. But that's a population that's for the most part not eligible to be vaccinated yet. And so we really need to take extra precautions with them to keep them safe and to help them not spread the vaccine to their friends, to their grandparents, to other folks in the community that may be more vulnerable. So our current positivity level in the county is 4.4%, which is not bad. It puts us in the blue level, but you'll notice that we're surrounded by counties who aren't doing as well as we are. And we know that counties are not islands, that what's going on around us will affect us. And so we're trying to keep an eye on that positivity rate. And here's the other problem, not problem so much, but concern that we're really keeping an eye on is that the positivity rate may not be accurate if certain age groups that have the highest rates aren't getting tested. That's why we really need folks to continue to get tested if you suspect you may have been exposed, if you're feeling symptomatic. We're concerned that we may be missing cases in youth because the youth in particular are testing less. We're also concerned because there are a lot of variants in the population, and the B117, which was the variant that originated out of the UK, has now taken over as the major variant in the state, representing 65% of cases in the state as of last week. And so we may be seeing increased transmission, increased disease severity, and particularly among children, there is emerging evidence of long haul syndrome for adults, but also among children of neurological impairments. And we're not sure which children are more susceptible to that yet. We don't have enough information. So it's really important that we really stay diligent about protecting kids from getting this disease. It's easy to dismiss it and say, they don't die, you know, they get over it. But for some children, it does have a big impact. So keep testing. So what we're seeing right now is about 1,600 tests a day. And we really just want to let people know that that testing is available, it's free, and it makes a difference to know if you have the disease, and you can help contain it so that we can really move into clear in May with a lot of confidence. In terms of hospitalizations, which are one of the key indicators and that are the basis for not being able to stay in clear, what we're seeing so far is we're seeing about 25 people in Boulder County hospitals a day for COVID-19. It's been steady the last few weeks. But what we're seeing also is that hospitalizations are increasing among younger people. So it's younger people who are having to be hospitalized at a much higher rate than they used to be. That's partly because of the variants. And we need to be careful to also recognize that this metric will drive a lot of thinking about whether we're able to stay in level clear or not. And the second piece that I want to mention to you about hospitals is that if you look at this pattern, and I'm going to show you the state hospitalizations on the next slide, and what you'll see is that the state hospitalizations are actually increasing quite a bit right now. And again, no county is an island. What is happening in counties around us will eventually affect us. And so we really, this is another reason why we really need to keep an eye on some of this data. This is the data about younger hospitalizations that I mentioned. So the final message is, number one, get vaccinated. Call the BCPH call center if you need help with registration or transportation. Keep testing, especially for youth. It's free at the fairgrounds and Stasios. Keep masking if you're indoors or not vaccinated. And parents, really help us step in to protect our children and our youth. Follow the guidelines, work with us. We want to help you. We want to keep everybody safe for a few more weeks so that we can open more in May and have a great summer together.
Thank you, Lexi. We'll pass it on to Lisbeth Mendoza, who is our community or equity community coordinator.
Hello, can you hear me? Let's see. Okay, so yeah, well, thank you for having me here. So let's talk a little bit and continue the conversation about the vaccine safety and efficacy. So I was listening to Lexi talking. I just want to emphasize the importance of acknowledging that this virus is extremely contagious. There are many things that we are learning. There are many things we didn't know when it first happened. It's a new disease for us. And what we do know is that it's extremely contagious. And this is where the importance from getting vaccinated and continue the measurements for containment take place. So also in support to what has been presented before, the idea of this reaching a vaccination critical level where most of the population are immunized or present some sort of immunity is depicted in this graphic where we see how when we have it to the left, we have a certain population in different stages of immunization. So in the first case, we have a population that is nobody is immunized. They have some people who are healthy initially and a couple of people who are sick, who have the disease. And as as they get together, as time passes, very fast in the case of the COVID-19, most of the people get sick and is contagious of all these people that are not immunized, and the point where there was no vaccine. And a few people are left who are healthy. We are in the second stage right now that we see in the second row, where we have some individuals who are healthy. Some of them are immunized. And when they, as time passes, and again, with this virus, we have learned is fast, we can still see that there is a level of contagiosity or transmission, but it's not as severe as in the first case, because there are some individuals who are immune to the disease. And then what we want to reach is what we see in the third row by vaccination, to have a critical amount of individuals who are immunized. And when, as time passes, only a few of the people who are exposed to the virus become actually sick and also transmit the disease. So the idea of the vaccines is that this is the safest way to limit the pandemic, meaning to limit the spread of this virus, limit the disease, the level of disease that we see. It's also the safest way because, as has it been, we have learned, we don't know who is going to get the severe form of the disease, and then who's going to be requiring hospitalization and intubation and all those measurements. And as we learned the hard way, our systems collapsed trying to take care of all the people who turned out to be not that few that got complications. So this is, acquiring the vaccine is the safest way to make it to achieve this immunity for the community where the spread is limited and the disease is not doesn't represent such a great burden as we have seen with we have learned with this disease. And of course, having this is going to help us to protect ourselves, protect our communities, and go back to a new way of life where we can, again, open our businesses, open our schools, gather with the people that we love, and feel safe, not live in fear, in a new way of living, being more conscious about this. I want to share that the vaccines are very safe. They have been submitted to a lot of observation, a lot of investigation. There's a lot of research behind them. Like any other vaccines or any other pharmacological products even, they have to go through all these clinical trials. And they involve several steps or several phases, starting with trials on cells and animals, and then jumping through phase 1, phase 2, and 3, where more and more individuals are recruited, where the vaccines are tested. And finally, the safety is determined. So these vaccines, the ones that we have right now authorized in the United States, had to go through all this testing and scrutiny. And even now that we are already over the phase 3, now that we are using it in the large population, we're in the phase 4, which means that these vaccines are still under vigilance for their safety. So the safety is a focus of the use of these products. Just to mention real quick, these vaccines have been tested in people from different ethnias and races, as well in different parts of the world even. So these people who participated are representative of the population in general worldwide. So this graphic represents the efficacy of the vaccines to protect us against COVID-19, COVID-19 being the disease in itself. And as we can see in the middle, we have the Moderna and Pfizer vaccines that we are currently using in the United States. And you can compare their efficacy, that is around 95 for both, 94.1 for Moderna, 95 for Pfizer, how they are very, very high in the scale of efficacy of vaccines, compared only to the German measles vaccine and the tetanus, that we all are very familiar, and we know how these vaccines managed to control these diseases worldwide that were, at some point were very worrisome for us. But they are very highly efficacious, and the same with our vaccines that we are using right now. And when we compare them to the seasonal flu vaccines, which are still vaccines with high efficacy, they are even superior to them. The research continues to learn more about the efficacy of these vaccines, and we will see how these numbers move. So before authorization, the FDA and the ACIP review all the documentation, all the cases, and finally decide if these vaccines can be used. These vaccines can be held to the same safety standards than any other vaccines. And again, as I was explaining before, the vigilance continues. And so we encourage people that once you receive your vaccine, please submit any effects that you consider important to submit to these systems. These systems are fed by you, by the user. And this is how we are able to recognize when there is some an effect that was not expected, that was not seen in the previous studies. Just to also emphasize that there are some facts as well as myths about the vaccines. And for instance, we have this in this graphic representing that getting vaccinated can actually help you prevent getting sick with COVID-19 and developing a severe form of the disease. Where previously there have been some misconceptions that you cannot, this vaccine cannot prevent you from getting sick or anything like that. Also, the people who have already gotten the COVID-19, they still can benefit from using this vaccine. It's safe in them as well. So the myth was that once you get COVID-19, you don't need a vaccine. But the reality is that we know now that, yeah, you actually need it and you can benefit from it and it won't hurt you. And the vaccines won't give you COVID-19, the technology used for these vaccines is relatively recent in terms of the application at this level, but it's research that has been backed by many years of studies before. And these vaccines are not like other vaccines where you receive a virus or like a kind of like inactivated virus. You cannot get sick from it. The construct behind it, the theory behind it, has nothing to do with introducing a virus in your body. So you cannot get COVID-19 from receiving the vaccines. So just, finally, the takeouts is that these vaccines cannot give you the COVID-19. You may have side effects. These are expected. These have been observed before. They don't put your life in risk. And these side effects are normal. It's just expression of your system developing the immunity that actually you need to fight the virus when it comes in contact with you. COVID-19 vaccines are effective at keeping you from getting the COVID-19 mostly, and importantly, the severe forms of it. And after you're fully vaccinated, you may be able to do some of the things that you used to do before, and still, considering that we still need to use our masks, our social distancing, and washing our hands thoroughly. And I think this is all for me now. And I'm very open to any questions and doubts. Thank you.
Thank you, Elizabeth. So now we're moving into the Q&A part of our update. So we will answer as many questions as time permits. Our presenters are approaching these topics from a place of respect, and we do ask that you do so as well. If we believe that that is not the case, we might need to mute any participant if necessary. We will be using the Q&A feature at the bottom of your Zoom screens, so type your questions there. For those on the phone, you can dial *9 to raise your hand, and we will call on you to ask your question, and to unmute, you need to use *6. Again, please keep your questions short, and we will be focusing on questions about the vaccine and the topics covered today. But if you have any questions that do not get answered, please send an email to healthinfo@bouldercounty.org. We do have a few questions here. Lisbeth, I think this might be for you. Lexi and Chris, feel free to jump in, but what are some examples of how you have helped different communities receive the COVID-19 vaccine? So this is talking about equity.
Excellent question. So yes, we're very proud of the efforts together with the community through our community ambassadors that represent minorities in our populations and people with difficulty in accessing the vaccines. So this I will say has marked our job in terms of equity in the vaccine. They have helped from the design of the clinics, the execution of the clinics, and anything that comes to improving the clinics. They have been instrumental in creating a welcoming environment, an inclusive environment for anyone in these populations that we know needed the most, and we call them priority populations in our equity work. So those I think that's one big piece of it. Mm-hmm.
Anyone want to add anything to Lisbeth's answer? Go ahead, Chris.
Yeah, thank you. Hi, everyone. Again, hi, everyone. Good to see you. It's Chris Campbell with Boulder County Public Health Emergency Manager. And thank you for all these wonderful questions. Always good to share this information with you all. Just wanted to add to what Elizabeth mentioned. So we've shared, several things in the past with community on our equity focus. Elizabeth has been instrumental in that. So we've worked on town halls and information sharing so that community members can make that good decision to get vaccinated. And Elizabeth shared just some of that information, answering questions about the vaccine, some of the side effects they'll see and what to expect. And as Elizabeth mentioned, we worked really hard and worked with a really grassroots group of community members to inform the experience at vaccine sites, so they are welcoming. We've shifted some things and really worked with community members to make that feel celebratory and really welcome community members so they can make a good decision to get vaccinated. We continue to look at barriers to access, including timing for clinics, and do hope to continue to provide, maybe after hours clinics and more accessible clinics potentially on the weekend. So these are ways that we want to work with community members and really ensure those barriers are removed.
Thank you, Chris. We have a question for Carol Helwig. Someone is asking about where they can report a restaurant requiring their employees to come to work after testing positive for COVID.
Yeah, I hope you can hear me. That can be reported by either calling the call center or by visiting our website, and on both an anonymous report can be provided. So our website is BOCO COVID-19, or perhaps that could be shared in the chat with participants. And our phone number, the call center, is 720-776-0822. And there is a link where you can fill out a form to report those concerns, or via the phone. And there's more information on the main page of our website under the Share a Concern or Ask a Question section on the main landing page for our COVID website.
Thank you, Carol.
Sure.
We have another question, and this might be for you, Chris. When will 12 to 15-year-olds be eligible for vaccines, particularly because we have the infrastructure and the vaccine supply?
Yeah, thank you. Another great question. And we know that particularly for the Pfizer vaccine, they have put in a request for emergency use authorization. And what we're hearing is, in the next 2 to 3 weeks, we should see a decision on that, or review and discussion from the advisory committee and others to review the safety and the importance of that. So we do anticipate that happening soon. And just so the community knows as well, we're talking with providers about this and planning for it. I think it'll be good timing for us to really work as a community, as Lexi mentioned, how important this is, important together to make sure our youth are vaccinated.
Thank you, Chris. We have another question about variants, and Lexi, maybe you can answer this one. Do you have any updates on the P1 variant?
Thank you, Angela. So the P1 variant is a particularly hard-hitting variant. It was found in Boulder County several weeks ago, but we are not seeing increased reporting of that variant. And at a statewide level, it's remaining at a very low level. Carol, do you have additional information you'd like to share?
Yeah, I agree with what you shared, Lexi. The state of Colorado is reporting on all of our variants, and that information is available and is updated regularly on the CDC website. I'm happy to put a link in the chat that can hopefully be shared. Right now, for all of Colorado, we are at under 1% for the P1 variant. But other variants, such as the B117 and the B1427/B1429, those are becoming more predominant in Colorado. The B117 is at about 33.3%. And the other variant, the B1427/429, at about 28.4%. the concern with the B117 is that it is has been identified to be more transmissible, 50% more transmissible. So it does make sense that of all the variants that are becoming more predominant, that's the one that's becoming most predominant. And the other one that we have is also more transmissible, but not as highly transmissible as the B117. Which is really becoming predominant across the United States. It's at about 44% for the United States. So we do anticipate that that it will become more common.
Thank you. Does anybody have any other additions to this question?
Yes.
Go ahead.
Yes, one thing with the variants that is important to consider is that although we don't know for sure if the vaccines are going to be effective or not, that's something that we will know. But we do know that when you have a variant in a population, and this is for any other viral diseases, if the population is immunized, there is going to be a less fast spread of the disease. So in viruses like this, in this particular virus, just having the people be vaccinated, even if we don't know how much of the immunity from the vaccine is going to protect us, we know there will be some degree of protection. So by being immunized, by being vaccinated, we're kind of like creating a barrier. Whenever the variant starts permeating the population, there's like a barrier with all these people that are immunized. So that we know for sure about the spread of the variants. So that's another importance of like vaccinating as many people as possible. Is almost like we are running against time. Like we know that they are coming, but we want to create these barriers with having as many people as possible immunized.
Thank you, Lisbeth. We have a very interesting question here. And maybe Lisbeth, this is also for you. Are vaccine side effects more prevalent among women?
That's an excellent question. That's a great question. So in the studies that, in the clinical trials, it wasn't significant, the difference in gender. The thing that was found a little bit more significant from this research point of view was in age. The younger people had more intense side effects than the elderly population, but we didn't have a significance. Nevertheless, in this effect that we found with Janssen was mostly the 6 people that were identified. Most of them were women. So that's one thing that we identified with this vaccine particularly, but not that it's significant from the statistical point of view that there is clearly worse for women than for men. No, not really.
Thank you. We also have another question. What other vaccines, in addition to Pfizer and Moderna and the POS J&J, will be approved soon? Will there be vaccines coming in from other countries? Is that a question for Chris or for Lisbeth or both?
I can take that one. So I do know that I definitely recommend going to CDC's website on this. There's a couple other vaccines, the AstraZeneca vaccine, the Novavax vaccine, that potentially they're in phase 3 clinical trials. So as far as I know, those are the only additional vaccine candidates the United States is looking at.
Thank you. Thank you, Chris. I want to be cognizant of time. We do have a few more. Again, they're asking about when teens will be eligible to be vaccinated. And this part of the question is also interesting. Are they going to be vaccinated at schools or public health? What is the plan when teens start getting vaccinated?
I can take that one, Angela.
Thank you, Chris.
Thank you all. Another great question. Again, I mentioned we're looking at the planning on that. It'll be, kind of another community lift here. Certainly potentially with providers. We're also, and I know the state health department is looking at working with primary care providers. That's kind of a place where healthcare providers. That's where where we usually go for vaccines for some community members. So we will continue to work on that for the community. Likely to be providers, again, like Boulder Community Health or other hospital providers. Potentially we'll partner with schools and looking at the needs there to vaccinate younger adults. In addition, I would look also with primary care providers for vaccines.
Thank you, Chris. Let me see. We also have one more question I think that we can take. Are you seeing any trends where transmission is taking place? And is there contact tracing? What's happening with that transmission?
Thank you for the question. We are continuing to see transmission, and thankfully we do have a very strong team of epidemiologists and case investigators who continue to do case investigations, outbreak investigations, and contact tracing. Our team works in various sectors. We have a sector that works specifically with our long-term care facilities. We have a business-specific business outbreak team. We work with higher education. We also have early childhood education team and a team that specializes in K through 12. And also a community team that works with our shelters, the jail, and healthcare facilities. All of our teams are still busy, unfortunately. We are continuing to see cases. Today, for example, we downloaded 85 cases from the state website that our teams are working on. I would say we have seen, for example, some improvements. Our long-term care facilities are seeing a lower number of outbreaks. Although we did have some new ones in the past week. We have 7 outbreaks in our long-term care facilities, although we're very happy to see that those outbreaks are fewer people and disease is less severe. So we can really see that vaccine is having a positive impact, even though we continue to see transmission occurring. I would say that our busiest teams, and Lexi shared this in her portion of the presentation, our busiest teams are our early childhood education and especially our K through 12 teams. So the teams that work with our younger community members, and we are seeing sports related transmission, for example, and different concerns there. I think across the board, it's very important for us to be able to continue to work with the community when someone does test positive. It's very important to work with the folks from our team who may reach out to you to contact you and learn about your contacts and make sure that you're isolating and quarantining safely in order to contain COVID from spreading in our community. It's going to become very critical as we try to get closer to ending this pandemic. So we're grateful for everyone who does collaborate with us to help us make sure that we're isolating, quarantining, identifying everyone in order to prevent the spread.
Thank you, Carol.
Could I just add one thing, Angela? Just to reinforce what Carol is saying. What we're not seeing is spread within the school environment. It is safe to send your children to school. The precautions that are being taken by the schools themselves with requirements on masking, ventilation, distancing when possible, they're doing a great job. It is safe to send your kids to school. The transmission that we're seeing is among kids in out of school events.
Absolutely.
Thank you. I don't know, Lexi, if you have other closing comments, or we can wrap this up. I want to thank everybody for joining us today. The next community update will be on May 5th. To keep you updated until then, you can go to our website at bouldercountycovid.org and visit our social media pages. If you have additional questions, please send them to healthinfo@bouldercounty.org. Thank you very much for joining us.